Hello, everyone. So this is our second presentation in our series about occupational therapy. And today we will be talking about ADLs and IADLs, which we introduced in our last presentation, but we just want to go a little bit more in depth about. So ADLs are activities of daily living and IADLs are instrumental activities of daily living.
Okay, so I'm going to talk a little bit about the activities of daily living. So these include dressing, toileting, bathing, personal hygiene and grooming, functional mobility, feeding, as well as, which we're not going to touch on today, personal device care and sexual activity. So to start us off, we're going to start with dressing, which is probably, it is something we do every day that we often take for granted. So included in dressing is clothing management, upper and lower body dressing and undressing. This also includes putting on footwear. And then the use of personal devices, prosthetic devices, or splints. So in this area or in this ADL, an occupational therapist can help with sequencing. So putting on your underwear before you put on your pants, hand-eye coordination, which is needed to dress yourself, modifications, use of adaptive equipment. Like we see in this picture, this woman the therapist is helping the client use a sock aid to put on a sock. This is used if there is decreased hip flexibility. And then an occupational therapist can also teach dressing techniques, which may include like a hemiplegic dressing. So if a person is unable to use one half of their body, this technique allows them to still dress themselves only using the functioning side. Clothing management is important, and it's probably overlooked by a lot of people, but this is basically just making sure you are selecting the right clothing for the season and time of day. You're not going to wear your winter coat in the middle of summer or your pajamas during the day typically. Our next ADL that we're going to cover is toileting. So toileting includes managing your clothing, hygiene, and caring for menstrual and continence needs. So as far as hygiene goes, this is basically just making sure you are wiping yourself after you go to the bathroom and making sure your skin is clean. As far as continence needs, this is making sure you get to the bathroom on time, and if you are unable to, you are provided with the proper resources to help. So in this ADL, an occupational therapist can help a person work on their standing balance, because you do have to stand up and sit down when you're using the toilet. So there is a transfer there. This is also important to work on safety in the bathroom, making sure you're not slipping and carefully sitting down. And then other equipment that might be used or an occupational therapist can help educate someone on would be a catheter or a colostomy or a suppository. As far as adaptive equipment, often occupational therapists can teach patients to use a toilet wand, grab bars, a commode, or a raised toilet seat, depending on the needs of the person and the setting. So bathing includes showering, sponge bathing, and getting in and out of the tub or shower. In this ADL, an occupational therapist can help with sequencing. So if you think about taking a shower, you're going to, most people wash their hair before they wash their body. Little steps like that, making sure you're using a dry towel after you get out of the shower. There's also a lot of energy conservation techniques that an occupational therapist can teach while working on this ADL. Some include using warm water instead of hot water to prevent a steam buildup because steam makes it harder to breathe, making sure to turn on a fan or leave a window open. An occupational therapist can also teach a patient to use a long-handled sponge to wash the lower half or back of their body. That way they're not bending in a way that might be uncomfortable for them. Another piece of adaptive equipment or modification can be using liquid soap or even soap on a rope, which is basically you're making your own soap by placing a bar of soap in a nylon stocking to help you reach different areas of the body. And then in this picture on the right, this just touches upon some of the other adaptive equipment or durable medical equipment that is available for the bathroom setting. So we see a handheld shower, which allows people to sit while they shower. We also have the non-slip bath mat, a grab bar, the shower chair, and then we, like I mentioned in the last slide, we see a raised toilet seat there.
So the next ADL is personal hygiene and grooming, and this covers quite a bit, including shaving, hair care, being styling and brushing hair, nail care for clipping nails, checking nails, even painting nails, applying makeup, skincare routines, and oral care, including brushing teeth, flossing, mouthwash, things of that nature. So OT helps in these areas by, again, assisting with the sequencing and planning, the fact that you need to put toothpaste on your toothbrush before you brush your teeth, shaving cream on your face before you shave, that sort of thing, as well as establishing healthy habits and routines. So helping clients to get in a routine of performing these things regularly so that they can prevent potential disease and other health issues. And providing education about that prevention is also a role of OT. So providing education about why oral care is important, how to effectively brush your teeth so that you can prevent various health issues down the line. And as the trend has been with every ADL, task modification and adaptive equipment. So using different pieces of equipment in order to help modify a task. So in the picture here is a long handled razor, and this can be helpful for someone who may not be able to reach or bend down to shave their legs. It can also be used for somebody who is pregnant or obese to help them be able to reach all the way down. So different methods like this for helping people to establish these routines and care for their hygiene fall under this category. Functional mobility is a pretty large category. We could see here, it's basically getting from point A to point B during daily activities. So this includes moving in and out of bed, moving in and out of a wheelchair or to another device like a walker or crutches, and different transfers to in and out of bed, in and out of a wheelchair, a car, to the toilet, a chair, basically anything that involves changing position and moving yourself from one place to another. In our last presentation, we talked about different adaptive equipment like wheelchairs and walkers and rollators. So OT's role in that is to help choose the correct adaptive device, choose the right wheelchair for their needs, and fit them to that adaptive device in a way that's comfortable and successful for them. So, as mentioned, we talked about a shower bench before on the picture on the left. That's demonstrating a man with hemiplegia. So if you see the shaded arm and leg, there are the limbs affected by a stroke that he had. So our role in helping to get him into the tub would be to show him how to use his walker to get to the tub and how to safely get in and out by addressing that affected side first so that his stronger side can help him to stay safe. So maintaining safety during transfers like this is a huge part of occupational therapy. The top right picture is a Hoyer lift, which can be used for somebody who's unable to use their arms and their legs to transfer. So this could be maybe a victim of who has hemiplegia or cerebral palsy or some condition where they're not able to transfer themselves. And the bottom right picture is called a slide board. And this is a piece of equipment that we use to get a patient or client from one service to another. So this could be from the bed to the wheelchair or the wheelchair to the toilet safely. So the slide board can be used for patients who are unable to use their legs effectively to transfer from point A to point B. So we would use that slide board to help them, and that's pretty common with spinal cord injury clients. So feeding is actually setting up the food, arranging the food, and bringing the food or drink to the mouth from the plate or cup. So this isn't the act of actually chewing and swallowing, it's instead getting the food from the plate to your mouth. So for feeding, we have a lot of different equipment we can use. I just picked 3 that are more commonly used. The first on the left is a universal cuff, and this is for clients who have decreased grip strength or who have maybe arthritis or they just have trouble holding on to a utensil. This is also commonly used with clients who have Parkinson's disease and who may have tremors. It helps to keep the utensils sturdy enough to feed themselves. Second is a nosy cup. And the nosy cup is used for clients who may have difficulty or may be unable to tilt their head back in order to drink. So in order to drink, you have to tilt your head back and raise the cup. For clients who are unable to do that, the nosy cup is really helpful because it has that groove there where the nose goes. So you actually drink on the opposite side of that groove. And when you lift the cup, you don't necessarily have to tilt your head back because there's a space there for your nose. So that can be helpful as well. And a non-skid scoop dish is helpful in many circumstances because it allows somebody who might have trouble getting the food on their fork or spoon. It gives them that lip there on the left to kind of scoop whatever food they need to get on the fork. So this can help with somebody who might have trouble with coordination, tremors, or just any sort of condition where they might have trouble coordinating that fork to food motion that's required for feeding. So now we'll talk about IADLs, which are instrumental activities of daily living. There are many IADLs. These are just a few of the categories. So education, work, care for others, play, leisure, and social participation. So instrumental activities of daily living are essentially higher functioning skills that we need to do day to day in order to feel fulfilled in life. So we will touch on specifics of these categories.
So first, we're going to talk a little bit about meal preparation. This includes planning out meals, assembling ingredients, cooking, and then setting up the table. So setting up your plates and utensils. For this IADL, the occupational therapist's role really focuses most on energy conservation. So this includes dividing up the tasks and preparation, Examples of this can also be sliding things across the counter instead of picking them up and lifting them from one area to another. Placing your ingredients in easy to reach spots. So you're not going to want to put it on your top shelf of your tallest cabinet or super low if you have trouble bending or reaching. And then adding in rest breaks as necessary or purchasing pre-chopped ingredients also play into that whole energy conservation. Another part of meal preparation that an occupational therapist can help a client with is kitchen safety awareness. So making sure you're turning off the faucet, turning off the stove, knowing when the stove is hot, shutting the refrigerator door, things like that. And then, as we've touched a lot on, and you can see in this picture, an occupational therapist can also introduce adaptive equipment. The man in this picture is using a rocker knife. The occupational therapist is providing him with hand over hand to teach him to use this tool. Other tools include a reacher, power appliances, which really save energy, a one-handed cutting board. There are so many adaptive devices to help someone with this IADL. The next IADL that we're going to cover is health management. Health management is basically what it sounds like. It includes physical fitness, nutrition, managing your medication, and then decreasing risky health behaviors. So primarily we see a lot of helping people manage their meds. So using pill boxes to set up good routines, good schedules, making sure all your medication is in the same area, making sure you're bringing it with you wherever you need it. And as far as decreasing risky health behaviors, occupational therapists do have a role in this because they help prevent chronic diseases. So this may decrease or reduce hospitalizations and other healthcare costs if we are able to decrease risky health behaviors. And then obviously nutrition and physical fitness are also big categories within this health management IADL that can be broken down quite further to create good routines. Financial management is also something an occupational therapist can help with. So in this situation, an occupational therapist may work with a client to help them handle money. This could be because of a physical impairment, like a fine motor impairment, or a cognitive impairment, like they're unable to or have difficulty producing the right amount of change or handling transactions. An occupational therapist may also teach alternate methods of financial transactions. So this may include using a credit or debit card, or even applying for food stamps or housing income or disability. An occupational therapist can help with all of these things. And then lastly, an occupational therapist is really helpful when planning for the future. So this might look like budgeting or wanting to save up a certain amount of money, short-term or long-term, whether that's as an emergency fund or retirement or for a vacation. An occupational therapist can help a client create that budget and break these things down.
So shopping is something that we need to do in our daily lives, whether it's shopping for food or clothes. It's something that the OTs can help people to accomplish. So in a cognitive sense, we help with sequencing, with creating lists, selecting items, purchasing and completing transactions, actually transporting the items from the cart to the car, as well as online shopping and electronic device use. So basically, the entire realm of shopping we assist with. And online shopping that can include kind of as Chrissy mentioned, using debit cards, credit cards, whatever electronic device you use for shopping and things like that. So some things that we consider as OTs is what time of day people are shopping, the accessibility of stores. Turns out stores aren't very accessible. If you're on a wheelchair or a scooter, it's really tough to reach higher shelves. So that picture on the left there demonstrates a therapist helping a client to reach a bag of chips using a long-handled reacher. So equipment like that we would assess with, and energy conservation, as we've mentioned in a few different IADLs and ADLs, is very important. So this could look like maybe somebody shops for all their dry items that don't need refrigeration, and then maybe they'll take a break and sit and have coffee or go to the cafe, or maybe they'll, at the end of the aisle, they'll take a seat on their rollator. So there are many different ways that we can accomplish shopping. And one other thing I want to mention is time of the day can make a huge difference, especially with a client, for example, who has PTSD or severe anxiety. Maybe they have anxiety about going to the store. So we might give a recommendation of going very early in the morning or later in the day when there wouldn't be as many people around, not as much sound, and just not as much busyness in general. So those are just some of the ways that we can help with the task of shopping. Home establishment and management is also a pretty large category because it includes essentially anything that you need to do to maintain your home and your possessions. And this includes your yard, your garden, appliances, vehicles, basically anything in your possession is included under home establishment and management. So for example, if your refrigerator breaks, we would help the person to either learn how to repair their possessions or to know who to call and who to contact for help with maintenance. So it's a lot of education, and also with cleaning and just managing the home in general. We help with different ways to accomplish that task. Driving and community mobility is any way that you plan and move around the community. This could be using public or private transportation. It could include driving, walking, riding a bike, any way that you go about the community. So we can help with accessing buses, taxis, subways, other transportation systems. We can assist with helping somebody to find bus routes and just how to safely navigate the community. And since driving is one of these things, I just wanted to show a couple of pictures on the next slide about how we help with the driving process. So occupational therapists are involved in driving rehabilitation programs, and how we do this is we assess someone in order to evaluate if they may be safe to drive. So we can do this by assessing their reaction time, the way that they make decisions, their judgment, and their cognition in general. So from that, we can do different virtual driving assessments. And then once we establish in partnership with a driving rehab program that this person can drive but may need some modifications to their car, these are a few things that we can recommend. So the picture on the left of the truck, that is a lift into the driver's seat. So the person would transfer to the driver's seat, and then it operates as a lift to get them into the car so that they're able to drive. So this may be somebody who just has general mobility issues. The car underneath it, the SUV, that's more of a ramp to help someone who may have a wheelchair to get into the car. And then for actually driving, the top right is a spinner knob. And this is to help somebody with poor grip strength who, or potentially even arthritis, who may have trouble gripping the wheel. They can use this. It's a little more comfortable for them and easier for them to actually turn the wheel. And the bottom right picture are various hand controls. If someone isn't able to use their legs or their feet to drive, other things can be installed, like such as hand controls, so they can safely maneuver their car. So these are just some ways that we can help with community mobility and driving. So thank you so much. We appreciate you watching our presentation, and we hope you learned a little bit about ADLs and IADLs, a little bit more about what occupational therapy can provide. And as always, if you have any questions, feel free to reach out.